Dr. Kohli is back this morning to touch on something we don't often think about too much, ear health. Dr. Kohli, how are you?
I'm great, Claudia. How are you?
I'm good. Well, I know all about ear health because I always have to go get my ears cleaned, and I like to do it like by a doctor.
Yeah, professionally. That's great. I love that.
Why is ear health, though, important?
You think about our ears, we take them for granted, right? They are the way that we communicate with the world. They're important for our safety. So if you're driving and you hear somebody honk, that's really important. They're important for our communication, how we socialize with each other, how we connect with other people. And believe it or not, they're also important for our cognitive health. So people who don't have normal hearing can actually have a faster decay in their cognitive health, can have more depressive symptoms and such. So the ears do so many things for us. We have to keep them healthy.
They really do. We just don't think about it as much as we should. Okay, I want to ask you this because as a mother of two girls, they're always on their headphones. The older one loves going to concerts, and it's to the point where I could see her phone saying, it's too loud, turn it down, and she won't.
Right.
Does that do damage? What kind of damage could that do?
Yes, in fact, it can do permanent, irreversible damage.
So
when we're exposed to loud noises like at concerts, it really can overstimulate the ears. And there's these tiny little hair cells in our ears that can actually get damaged. So what a lot of doctors recommend, which sounds counterintuitive, is that when you go to a concert, you're going to be exposed to loud noises for a long period of time. You actually want to think about putting in earplugs so that you still can enjoy the music, but do it in a way that's sort of safe for your ears. And I know I don't do this myself, but when I travel, I have my headphones in for hours.
Yeah.
And really what they say for optimal listening, you should be at the 60-60 rule. So you should be 60% of the maximum volume on your headphones for only 60 minutes at a time. And then you actually take a break. So what we see on the planes where everyone's got their headphones on for hours and hours, that is not a healthy way to listen.
Well, now with the kids, the AirPods are in 24/7.
Exactly.
Should we say, take a break?
You have to tell them to take a break.
Okay.
Because you're overstimulating those cells, and those are cells that are very delicate. And they not only help with our hearing, they actually help with our balance. So if we have ear problems, we can start to have issues with our balance and such too. So you want to make sure that your kids aren't abusing their ears. And what we're seeing, in fact, is that there is a higher incidence of hearing loss, premature hearing loss in the modern era than there ever used to be before, because we are listening to a lot of concerts, we're listening to loud music, we're stimulated by technology, we've got our headphones in all the time.
It's definitely a problem with the teenager, in my case, and the AirPods. Now, how should we clean our ears? This is an interesting one because some people say, I use Q-tips. I cannot not use Q-tips. I do not use Q-tips. But what's your take on that?
So medically, you should not use Q-tips.
Okay.
Because what do Q-tips do? They actually push the earwax further into the ear canal. So you're causing it to be impacted, or you're just smearing it around. You're not necessarily removing it or taking it out of your ears. So the way to clean your ears, and you should clean your ears every day, is the external part of your ear, this cartilaginous part. You clean in the shower, or you clean right after the shower using a wet cloth or using a little bit of soapy water. As soon as you get out of the shower, you want to dry that part off right away. A lot of times if we go swimming or we're in a bath or a shower, we don't think about drying our ears, but that can actually help reduce the risk of infection. And then to clear the insides of your ears, you either get it professionally done, as you do. Or you think about talking to your doctor about whether eardrops might make sense, because these eardrops kind of soften or melt the earwax, kind of make it a little liquidy so that it starts to dissolve and kind of come out on its own. And you're not actually advancing anything like a cotton swab towards the eardrum, which can cause trauma, or of course, like I said before, it can cause impaction of that earwax.
No, definitely. Now, what are some signs of ear problems to watch for?
So this is important because a lot of my patients sometimes have something in their ears and they sort of blow it off. So if you have hearing loss, whether it's complete hearing loss or partial, you're just not hearing very well, something is muffled, something is soft, that's something that needs to be addressed right away, because the sooner you get treated could actually impact how you resolve it. If it's inflammation or something in the ear, if you have any ringing in your ears, if you have any kind of ringing, whether a lot of times people tell me they feel their heartbeat in their ears, they can kind of hear the heartbeat, or they just hear a ringing sound or buzzing sound, those are abnormal signs as well that you should get something checked out right away. And then if you have any ear pain, whether it's in the ear canal itself or behind the ear, or any problems with balance, these could be signs of an infection. Those also need to be examined.
Need to be checked right away. And real quick, how often should we get our hearing checked?
Yeah, so this is something I didn't know until I actually looked at the guidelines, but starting at the age of 50, we should have a hearing exam. And, you know, when we're kids, and obviously we get a hearing checked much more often. My niece and nephew go all the time to the doctor to get their hearing checked because it's part of their language development and it's important. But as adults, it's important for us to do it regularly too. So at least at 50, earlier if you're at risk for ear problems or you've had ear infections or anything like that before, and then regularly thereafter to make sure that we're not actually losing our hearing and not realizing it.
That's right. You hear that, Dad? He cannot hear me, and he needs to go get his ears checked for sure. Thank you so much, Dr. Kohli, for being with us this morning. Okay, make sure to email us your questions for Dr. Kohli. Just send your message to mycoco@9news.com and put Kohli in the subject line.